So I thank the panel for coming along, and I thank the public for coming along, and I welcome you all. So today I am going to say that it is a very emotive subject, dentistry. It's been one of the most significant issues that Healthwatch has had, let's say, coming through the email, the post, the door, whichever means and mechanisms you would like to say. And it has raised, you know, over the past 18 months, a lot of, I will say, anxiety. We've seen a large increase in the volume of feedback and the amount of negative sentiment in that evidence. However, more strikingly, we've noticed that there's been a continuation over time. The issues are not in pockets. There's people all over every corner of England, I would say, that are struggling to get treatment. So we're not isolated to Lincolnshire. I think people, it's fair to say people feel pressurised to go privately. It seems as though if they can't get NHS treatment and they're willing to pay private, which seems very difficult to people on a low income. That's how it appears. So being unable to access care or having it delayed has obviously left people in severe pain. You know, we've had so much information come in from the public, of which we thank you for your heartfelt honesty, let's say. We've had to really tailor it down, and I don't mean that in a negative way, because it's heart-wrenching to see and hear some of the stories that we've had to read, but it's about broken teeth, fillings, dentures, and, you know, swelling, people in real pain and agony, and really unable to even get preventative care. So, and leading to worsening dental problems over time, and tooth loss. So that's why we're here, and this is why, as chair of Healthwatch steering group, we've now brought together at our YourVoice, we've brought a panel of what we feel are experts in their field to discuss this. I don't think anybody can fix it overnight, as they say. So without further ado, I'd like to introduce my panel. I do apologise, I didn't introduce myself. Many people do know me, but as I've done this for quite some time. But I'm Pauline Mountain, and I am chair of the YourVoice at Healthwatch. And I'm also a trustee on HW Links. So without further ado, I'm going to come to ladies first, and I'm going to come to Lucy Gravens. I'm going to call you Gravesens, Gravens. So if you wouldn't mind putting your mute off, Lucy, and give a quick overview who you are.
Yeah, thank you very much, Pauline. Good morning, everyone. My name's Lucy Gavins. I'm a consultant in public health at Lincolnshire County Council, and oral health is part of my portfolio. So it's good to be here with you this morning. Thank you.
Thank you. Adam, I'll go next in alphabetical order, sorry.
No worries, thank you very much. Thank you for the introduction. I'm Adam Horby. I'm the Regional Chief Dentist and a practicing dentist in Staffordshire.
Thank you. Caroline, while I've got you online, because you couldn't get on a little while ago. You're on mute. Mute.
I think Caroline is having difficulties with trying to get the audio connection, I think.
Okay.
With the Wi-Fi. So, yeah.
Okay, I'll move on to Kenny.
Good morning. My name is Kenny Hume. I'm a dentist in Lincoln. I've been in Lincoln for an awfully long time, and I'm chair of the Lincolnshire Local Dental Committee.
Thank you, Kenny. Any joy, Caroline, or not? No. Okay, thank you. We'll shake and nod, and we'll do hand signals probably with you. Okay. Right, so I'm going to start with a question to our panel, and I'm going to start on what is probably the only positive, but it's sort of I'm going to come to Lucy, and I'm going to ask you, Lucy, really probably starting at the earliest stage of our lives, and you're from the public health aspect, aren't you? So thinking about our children, so I want to ask you why our children's tooth decay is so high in Lincolnshire, especially in the east of the county. Can you give us any indication of that?
Yes, yeah, thanks, Pauline. So tooth decay is the most common oral disease that affects children and young people. And as you've kind of mentioned, compared to the national average, Lincolnshire does have a higher proportion of children aged 5 with visible dental decay. It's about 1 in 4. And the trend shows us that has been getting worse over time. And as you've mentioned, there is wide variation across Lincolnshire. So in Boston, for example, we see that 4 in every 10 children, it's just under 40% aged 5 years old has got that visible dental decay, compared with under 2 in 10 in North or South of Stephen, for example. It's around 15% there. And actually those rates in North and South Stephen are significantly lower than the England average. So it's 15% there and 23% nationally. So we see a really mixed picture across Lincolnshire in terms of that visible dental decay. Some of the key risk factors for tooth decay in children are a poor diet, so a diet that's high in sugars and starches, and poor oral hygiene. So particularly, for example, brushing teeth less than twice a day. Ideally, we'd want someone to brush their teeth at least twice a day with fluoride toothpaste. But there are also really clear links to deprivation. So we see this nationally as well as in Lincolnshire, children living in more deprived areas where there's an imbalance in income and education and employment and other factors are at greater risk of developing tooth decay. The other really protective factor is fluoridated water. So fluoridated water is a good way to safely and effectively lower the risk of and severity of dental decay. In the west of Lincolnshire, we have a fluoridated water supply, and there we see significantly lower rates of decayed, missing and filled teeth in young children. So why are the rates so high, particularly in East Lindsey, South Holland and Boston? I mean, in part that east-west difference can be explained by the fluoridated water supply, but that doesn't explain the whole picture. It's definitely a big part of it. So factors such as deprivation, we see many of our communities down the East Coast particularly, there are high rates of deprivation, and the impact that has on diet as well as variations in protective behaviours such as toothbrushing are likely to explain a large part of the difference that we see across the county. So
tell me what public health are actually doing about, you know, managing that. I suppose it's difficult because it's families.
Yeah, absolutely. I mean, improving child dental health does require a whole system approach. There's something for everybody across the sector, from kind of national and local policy right through to healthcare, families, the food and drink industry. There's lots of different kind of players, if you like, and who need to contribute together to improving child dental health. So we work closely in public health with Kenny and Adam and colleagues from across NHS England and other sectors, for example, to understand local needs. So to understand some of that picture that I've just described around where we do have pockets with particularly high levels of dental decay, and put in place programs to improve or try and protect oral health. So I can give a few examples. So in Boston, where we do have that really high rate of dental decay in 5-year-olds, we provide free toothbrushing packs as part of the health visiting program when a child reaches 6 to 8 weeks of age, and that's to try and promote those really positive toothbrushing habits from a really young age within families, and to try and the health visitor who's there can support those families in understanding, you know, how to brush their child's teeth from that young age, or their gums as it often will be at that point.
Do you have a good take up for those?
Well, it's given out as part of a routine visit, so every family should get that pack at that 6 to 8 week health visitor appointment. So yeah, it's sort of a universal offer that everybody will receive one of those packs in the Boston area, which hopefully by talking to everybody, it means that we will be able to encourage families to brush teeth from a young age. And obviously, if there are older children in the families as well, hopefully the health visitor can have that part of that conversation with the whole family. We have other programs. So we've got something called the Lincolnshire Smiles program. That's delivered by the oral health improvement team in the community dental service. And that's a supervised toothbrushing program in some early years and primary education settings, particularly again in those areas where we know there are high rates of dental decay or oral health need. And that's to prevent that decay and establish lifelong kind of good oral health behaviours in young children.
So I suppose really what I'm hearing that, you know, you as a public body are doing what you feel is, you know, you're reaching out, but then obviously where there's something lacking, forgive me for being direct to you, but there's something lacking if we're way down that scale. So what can we do as Healthwatch, for example? What can we do as that public facing organisation? What can we do to support our public? And more importantly, what can the public, I've got an audience of public. What can we all do to support, you know, our fellow beings, I suppose, without being condescending? I don't, you know, that's unfair, really, isn't it? So how can we support each other?
Yeah, that's a really good question. I mean, I suppose there are some key messages around how we as individuals, as families, as kind of communities can support oral health and wellbeing. So things like around good behaviours, around toothbrushing, for example, eating and drinking fewer products that contain sugar. But that's not just about individual behaviour choice. Obviously, a lot of us are driven by what we find in the environment around us. So that's where, for example, working with the food industry, I think is really important, because if we can lower the amount of sugars in soft drinks, for example, then it's small steps that actually at a population level can make quite a big difference. I think the other thing to touch on, and just thinking about what we can do across the county that doesn't come down to kind of individual behaviours, is around that fluoridation. So at the moment there is a health and care white paper progressing through Parliament that is looking at fluoridation across England. I've mentioned that we have half of Lincolnshire fluoridated and half that isn't fluoridated at the moment. That white paper is looking at whether or not the fluoridation would be taken back at a national level, and be one of the responsibilities of the Secretary of State for Health and Social Care. If we can get to a point where we had fluoridation is one of the safest and most effective ways to improve our oral health. So I think that's really something we want to be thinking about as a system across Lincolnshire.
And I think as Healthwatch, that is something that we can do. You know, we have almost a direct line in, don't we, really? You know, we are put in by government. You know, they say, look, we need you to be there as a direct interface with the public. And, you know, to me, I'm not paid to do this. I'm a volunteer in what I do, and I'm a public member, and I want to see, you know, my children, my grandchildren have proper facilities, and the same for the rest of Lincolnshire. So for me, that as Healthwatch, that's what we can do. We can go back and say, right, let's bang the table and beat the drum and etc. So we can take that back to our board and say, look, right, so this is something maybe we should be, well, not maybe, but this is something we should be following through. So I can see Dean writing down, and Una's going to. I know Una's, for our members of our public, she's certainly putting things in the chat bar that you're picking up on. So thank you for that. And I think that's sort of set the scene, really, hasn't it? I want to come to Kenny, really, and ask you really, what are the current challenges then for dentistry in Lincolnshire?
Thank you, Pauline. Before I sort of answer that question, can I just like to point out, and I know it's perhaps stating the obvious, but dental decay is totally preventable.
Yes.
It's a totally preventable disease, and that the most common admission for hospital general anaesthetics and under 12-year-olds is to remove teeth. So the question, what can we do as a group, as a society, and it's throughout the whole country. Deprivation does play a big part, as Lucy said, but we can do things within our own households to prevent decay very simply. So rather than have the can of Coke when you're having your evening meal, you have water. You know, thirsty children will drink water. So, you know, it really, to have a general anaesthetic admissions, which are, you know, life-threatening procedures for something that is totally preventable, we need to get that point across, I feel.
I absolutely agree with you. And I think there's often fear attached with a dentist. So, you know, but the fear of, like you say, I would rather come to you than go under an anaesthetic. Adam, you've got your hand up. Come on in.
Yes, so it was just really to follow up on exactly what Kenny has just said and follow up with what Lucy has said, in that in healthcare we have sort of like every contact counts. And I view this as a contact with the public in any opportunity where we can get those all health messages to people. So people listening today, if they can actually sort of go away and talk about those with their families, with their friends, the importance of diet, high sugar content foods to be aware of, and daily brushing with fluoride toothpaste, all of those messages will help the preventative nature to try and prevent tooth decay, so that we don't have our sort of loved ones and dear ones suffering from problems that they needn't necessarily suffer from.
But parents do get sort of challenged, don't they? It's like, oh, but mum, you know, everybody else drinks Coke. Well, I'm sorry, but you're getting water.
Yeah, it is very, very difficult conversations. I mean,
absolutely,
I've had those in our own household with our children. But you know, as a parent, you want better for your children than you've experienced yourself, basically.
I remember doing it with my kids, and they thought I was really awful. But I put a penny in a cup, well, in a glass, and then poured Coke on it. Yeah,
and I think the other good example there is when you actually put a young child, when they've lost one of their baby teeth, if you put that in a glass of Coke overnight, it'll have disappeared by a couple of days' time.
Yeah. There we go. Dean.
Morning, Pauline and everyone else. I thought it'd be a good opportunity just to share one of our quick polls, because just based on something that Adam said around making every contact count, you know, we asked the sort of public of Lincolnshire to complete some quick polls, and I've just got the result of one of those. So we asked 236 people, and we asked that, you know, when was the last time you had an NHS dental checkup? And 22% said in the last 3 months, 15% said between 3 and 6 months, 11% between 6 months and a year, and 6% between 1 year and 2 years. But a further 45% had not had a checkup in over 2 years. So I think obviously making that contact count and the issues with people with access to dentists. So I think that kind of gives a nice context into, I'm sure, what Kenny's going to talk about with the challenges to dentistry at the moment.
Yeah. Thanks, Dean. I think that puts it into context, doesn't it? You know, when you hear those statistics, and that has come back from the public. So, you know, they're interesting to calculate. Kenny, your experiences. Where'd you start?
Indeed. Thank you, Pauline. I mean, your introduction said that we face significant challenges in Lincolnshire, and the input into Healthwatch has all been access is the main issue, really. We know that. It's not just primary care, it's secondary care as well. We don't have the specialist services that other areas have, for example, in paediatric, dentistry, special care, things like that. The issue is national. It's not just confined to Lincolnshire. but the rural and coastal communities in England seem to be the ones that are suffering the most. COVID has played a huge part in this, in dental practices, because of the infection control procedures that were that we had to follow. It meant the throughput of patients coming in the door reduced significantly, really. And so I think we lost something like, in a 21-month period, we lost a year's worth of treatment. I think Adam will back me up in that. It was figures like that. So we lost a huge amount of people coming through the door, really. So that's the problem, really, you know, in a nutshell, really. But the problems that we had, or the problems we have now, should I say, some of them, most of them, were there before COVID. So COVID has been a huge factor, but also there are issues, underlying issues as well. So, but we're well aware of that, and we sympathise, and you know, we can understand, you know, how the public are struggling. You know, it's not a situation we want to be in. As I said, I've worked in Lincolnshire all my practicing career in one practice, so you know, I've seen things come. When you're in one practice all your days, you do see things coming back to you. The buck does stop at you, so you do see the issues that we're facing just now with lack of access and how difficult it is to get a dentist. So you know, we understand, and
you do raise a really good point, actually, Kenny, and I'd like to bring Adam in here, because you're sitting in a national role, really, aren't you, in NHS England, and how is your remit to improve that dentistry for Lincolnshire residents? Because obviously I know, you know, NHS England is there to, you know, cover the whole of the country, but we're interested in Lincolnshire, and I see, you know, you've got sort of the map behind you there. And I actually come from the other side, Shropshire, originally. So yeah, but how are you going to satisfy us over here in this part of your domain? Because we're gonna, you know, we're gonna keep poking you and saying, come on, you know, we always we don't get the lion's share, you know, we don't get what we should. So, you know, now we've got you, we know your face, we're going to hound you.
Yeah,
and Kenny's going to do that as well.
Yeah, and that's absolutely correct, and that's what we'd expect, basically, because at any point in time we always expect to be challenged to obviously try and get the best outcomes for patients, because that's ultimately what we're all here to try and achieve, basically. So obviously I sit as the first regional chief dentist that's been appointed in the country across the whole of the Midlands, of which obviously Lincolnshire is that part of the region in my region. It's, as Kenny has raised, there's been so many multifactorial issues that have occurred since the beginning of the pandemic, which was like 2 years and 7 days ago, basically, that we went into the first lockdown. And as Kenny has alluded to, there were issues before we went into lockdown. And I think as a practicing practitioner, to actually shut your doors of a practice and not actually take in patients, it was quite alien and strange for all practitioners. And within a very short period of time, within a week or two, we'd managed to get sort of urgent dental centres operative across the region, so that people could have access who were in those dire emergencies, you say, with swellings, broken teeth. They were able to get access. Meanwhile, sort of practices were just giving access in terms of advice and analgesics and antimicrobials where they were needed.
Sorry, I'm going to cut across you, because that's not what we were hearing, Adam. That people were really not getting any service. They were not getting it.
Yeah, for 10 weeks, literally, practices were shut, and all we could really do was give advice.
But even
and then sort of after when the practices sort of reopened in June, early June, the 8th of June, the problem that we all faced was there was a great unknown, really, about sort of how to practice in the environment with COVID. The primary aim was to ensure that we'd got patient safety. So in the early days, if we did an aerosol generating procedure, so whenever we drilled in somebody's mouth and created the aerosol with the water sprays, it actually spread that virus into the room. So we'd have to leave the room for at least 1 hour to let the aerosol settle before people could then re-enter the room to actually clean the room and then get another patient in. So that affects that throughput of patients that we were able to achieve in practice, from normally sort of quite high numbers in a day, just down to literally a handful of patients in some circumstances. So that there was the huge problem that we had from June of 2020 right the way through till about sort of December of 2020, when practices were only sort of achieving about 20% of their normal throughput. Now, Kenny mentioned about the obvious numbers, the drops in figures of patients that they've seen. And in sort of the county of Lincolnshire, normally so it's just under about 400,000 patients uniquely sort of attend any dental practice within a 2-year period. And it is really to the sort of the congratulations of the practitioners in the area that they've managed to keep those figures to 82% of the normal throughput of people. So whilst that is still sort of a good throughput of people, it does mean there's a backlog of 75,000 people that still haven't got access, that used to have access. But then on top of that, we've also now got the an increased demand for service as well from the normally routinely only 0.5% or half the population attended a dental practice routinely. So that other half that regularly didn't go are now sort of needing access as well. And that sits on top of those patients that we've got the backlog with the 75,000. So there's a huge backlog. The percentages that practices have been able to work at in terms of the thresholds in patients they've been able to see have gradually increased, and they're currently up to 85%. And we're currently waiting for imminent information from the national teams to actually tell us of what, as I will be a practitioner, to what percentage I've got to work to on Monday, basically. We're always constantly trying to see 100% of the patients that we used to. But as I say, it's the infection prevention control measures that we have to put in place to ensure safety for patients that really do drastically affect the efficiency of all practices. And that is also one of the problems we've had with secondary care as well. And on top of that, with secondary care, some of the people in the hospitals that would normally deliver services for dentistry, they were sort of redeployed to actually take part in the vaccination programme. So that has then caused the backlog of people we see in practice that we would refer on to secondary care. There's nobody sat in secondary care to actually see them as well. So it is one of my main priorities to actually ensure that we try to reduce these backlogs. We're working with the Get It Right First Time team, the national team, to actually look at reducing oral surgery waiting list times across the region. So that is, you know, we're working with all the different people that we possibly can, trying to put in additional sort of working sort of schemes and initiatives as well. But
so can I? There's a question, well, a comment, I think, from somebody in the audience that's saying that no new patients are being taken on. How does that work then? Because obviously I appreciate you've got a backlog, but
yes,
but how do people access when they need new patients? You know, people moving into the area, etc. People still need to access a dentist.
Yes.
So,
there is no.
This that's come into this is saying that nobody's being taken on.
Yeah, there's no such thing as a patient registration. That sort of ended back in 2006. So where there isn't a patient registration, so there's just notional lists of people that do attend practices. So it's really, and through this pandemic, we have to sort of triage patients to see those patients that have got urgent needs and urgent clinical needs. And those are the ones that need to be seen over and above those that just have a routine sort of intention to actually want to have a checkup or an examination with a dentist. Dentists have to give priority to those with urgent need, basically, at the moment.
Okay, so there's gone are the days where you just continually have your 6 monthly checkup and you keep going back and.
Yeah, no, that is sort of for a long time we've had NICE guidelines, the National Institute of Clinical Excellence, and they've done reports for dental examination recalls. And we really do have to triage patients to see what their needs are. Some patients need to be seen on a very frequent basis, sometimes monthly, 2 monthly, or even 3 monthly if they've got sort of certain conditions or gum disease conditions that we need to sort of keep on top of and manage and maintain. And then other sort of individuals that have got very good health, oral health care and sort of got no sort of experience of any dental decay or any restorations, those can be put on more prolonged periods of time. So we do have to sort of adjust the sort of recall intervals for the different types of patients that we see so that we can best manage the time that we've got efficiently to make it available for those that do need urgent care.
Again, there's a couple of comments in the chat bar that's saying one is the NHS England website is still referring to registering with an NHS dentist, and then there's another comment that's saying could the NHS resource that's being used for routine scale and polish be diverted to other things? So.
Each practice has its own sort of contract, basically. So that dentists that work for the NHS in dental practice in the high street, they're not actually employed by the NHS. They work under a contract for that service, basically, to provide that service. So that the money that they hold is then to sort of fund and sort of actually provide dental treatment as is needed by the patients that they then see.
Okay, so that brings me on to another question then about the, it was announced that there was additional funding for dentistry.
Yes.
So how's that used in Lincolnshire, and bearing in mind what you've just said, how will that benefit the residents of Lincolnshire?
If I can go back a slight little step before that, obviously with the pandemic and all the issues we had and all those percentages I mentioned where there was a reduced throughput of patients in practices and what practices were trying to do to deliver care. As a region, we've realised, and especially in Lincolnshire, we've realised some of the issues that we're facing practitioners. So one of the first things we actually did was to put forward a ventilation scheme survey that practices could actually look at to try and introduce ventilation into their practices so that it would reduce the downtime in between patients where aerosols had to settle. We've also put in place sort of extended access for weekends. So outside of the normal working hours of practices, we've instituted schemes and invested in schemes that will allow improved access at weekends and also during the weekdays. There's been 8 to 8 sort of access slots made available. Dedicated 111 slots have been made available to by certain practices. And we've also sort of invested heavily in oral health promotion programs, as Lucy has said, to try and sort of get the promotion of oral health and prevention out there as well. And then, so we've done a vast array of schemes to try and help sort of provide services for patients above and beyond what was already contracted for. And then literally had the £50 million of funding that came in sort of just after Christmas in January of this year. And literally the government gave £50 million to be spent in 50 days, which from a regional point of view, we would have much preferred to have had that money much earlier in the year, that we could have made much more use of it and much more advantages to be gained from that. But that money is, we only had 50 days and the last day of being able to use that money runs out tomorrow, unfortunately. But because we have done, and it can't be accrued to any future years, but because we have done a lot of work in the regions, and Kenny as a local dental network chair has been working hard in the area to try and look at the health inequalities and where we can actually promote better access to different things. We've done a tremendous amount already, as much as we can in the area. But ultimately, it does come down to practitioners that wish to take up those offers. And sometimes there have just been fewer practitioners in the Lincolnshire area that have taken up those schemes in comparison to other counties in the region, I'm afraid.
So, Kenny, I mean, how have you benefited from that extra money?
Thank you, Pauline. Can I just sort of take it away now from Adam's been on his feet there for
Thanks,
about
Adam. Thank you, Adam.
20 minutes or so, Adam. So,
I'm not sure I understand it all, but hey.
No, thank you, Pauline. Can I just get back to the, you know, we talked about the challenges for access and realise perhaps why we're there.
Yeah.
You know, because we're hearing all this negativity. But we have a shortage of dentists in Lincoln. I mean, you know, you can't provide access if you don't have the workforce, really. And we have significant workforce issues in Lincolnshire. And there are many. It's not just one particular thing, there are many. So we have a sort of, I'm a baby boomer. All my friends are retiring, have retired. And we are a generation that worked 5 days a week. Mm. You know, we were full-time dentists. We were in on a Monday, we finished on a Friday, and some of us worked a Saturday morning as well. Mm. The younger generation don't see that as a future, really. Much has been talked about the dental contract, and it's unworkable, it's not fit for purpose and all the rest. And they don't see themselves working in that environment with that contract for the rest of their lives. The other thing that's happened is that when I started in my career, you worked as what we term an associate, so you worked for a practice. And after 5, 10, whatever years, your ambition then was to become a partner in that practice, a partner in another practice, or buy your own practice. So there was a sort of a career progression, if you like. And if you're working in your own practice, you make sure, because dentistry is a sort of, it was item of service. So if you laid 1 brick, you got £1, 10 bricks, you got £10 then you made sure that you were in your practice working 5 days a week. And as I said, the younger generation coming through don't have that thought process. And one of the reasons is that a lot of practices are now run by what we term corporates. They're the Bupas of this world, the My Dentists, whatever. So that opportunity to buy into a practice and therefore create stability. So once you've bought into your practice, you stay in an area for a long time. I won't tell you how long I've been in Lincolnshire, it would be embarrassing, but I've been here, as I said, all my life in one practice. Now, that's very unique, but it just doesn't happen anymore because people are constantly moving around, but they see themselves working part-time. So although it might say, yeah, we're producing still the same number of dentists as we did 5, 10 years ago or whatever, if a lot of those are, all those dentists and most of those dentists are working part-time, we need more dentists. We need to be training more dentists.
Kenny, how do we do that? Because it's similar across the whole of the NHS, isn't it? That we hear and we have heard for many, many years now. And I suppose from a public point of view, we know, well, I say we know, many maybe don't know how long it takes to train, whether it's dentistry, a doctor, or I'm going to say a vet as well, because, you know, they are all in what you would call that sort of category of having to have that very long. In fact, I think a vet is longer, isn't it? So, and we value our pets. But how long does it take to train a dentist?
5 years.
Yeah. And they've got to be, and that's got to be, like you say, it's got to be dedicated. It's got to be it can't be what I would call a job. It has to be a vocation. And you've got to dedicate your life to it with all of those professions. So Adam's put his hand up. Are you going to give me the magic answer of how we do it?
No, unfortunately not. There's no magic answer, I'm afraid. No. But a slight aside and bit of magic answer is that we've got very good dental teams that are made up of lots of different type of people. So what we need to use is the skill mix of those teams. So we've got dental nurses that can sort of give out advice on oral hygiene measures. They can be used to actually give fluoride applications to young children in practices. So what we've got to try and move away from is the time where the dentist is actually providing all of those bricks and laying all those bricks. The bricks or some of the things in between those bricks can be actually done by other team members. So as I say, nurses can be trained up to give sort of advice and fluoride applications. Hygienists in practice can be used in different ways, and we've got therapists as well. So therapists can actually provide sort of very basic fillings and things along those sort of natures for people as well. So it's using the skill mix we have within our dental teams in a different way moving forward, which will actually help try to give better access.
I've got Caroline with a hand up as well. Sorry. Yeah, go on, Kenny. Can you come in, Caroline? Can you?
Yeah.
Oh, there we go.
Can you hear me now?
Yes.
Oh, right. Okay, that's fine. And I think it's right. The workforce is the issue. We have put significant investment in across East Midlands and Lincolnshire because we recognise this isn't good. This isn't right for patients. But the issues with Lincolnshire is the workforce. If you don't have the workforce, they can't take you up on your support measures to help the services increase. So some of the things we're looking at this year are going to be slightly different compared to other areas in the respect that we will be looking at incentive schemes to attract dentists into Lincolnshire, you know, to trial that, to pilot that. You know, the other things we are considering within the region is, do we look at how we can attract international dentists into Lincolnshire and have a bespoke service trialing it and piloting it? Because for me and for our team, it's not that they don't want to improve services, they work really hard to. And, you know, in particular, I think the data that Lucy was sharing about the differences in where the county sit you can see that in the commissioning of services as well, Pauline. So we've tried really hard to secure services across the East Coast coastal area. Kenny knows we've tried a number of times. We cannot attract the market there. So, you know, the team that I work with, which will be with Lucy and Adam and Kenny, is right, we need a different model for Lincolnshire, or we need a different model for that part of the county because it isn't working. You know, it's fair to say that Lincolnshire's issues are modelled in other areas. You mentioned you came from Shropshire. Well, Hereford and Worcester is in a very similar boat to us. It does seem to be impacting the rural counties more and the coastal counties more. I think there are things we need to grow around the workforce, as Kenny said. If you're not located, there are problems if you're not located near a dental school, Pauline. That can be quite hard to attract trainees into the area and then grow them and keep them. I think what I can say is, as being responsible for commissioning dental services, I admit this, it isn't where we want it to be, but we will continue trying to make improvements and positives. And, you know, when I look at some of the comments in the chat about, you know, I've got clients that can't even get urgent care. As much as I'm not in a position, I can't comment on individual patients' positions. My team will look, if they have not been received urgent dental care, my team will look at it, and I would urge everyone to raise it through NHS England's contact centre, because we do get that data, we do get that information, and the team will speak with the dental practices to change practices and work out why the issues are. So you know, I think Lincolnshire has an acute issue. COVID has impacted the issues for dental, and I think it's fair to say across the NHS staff are tired, Pauline, and that is echoed with it. That is echoed within dentistry as well. You know, we had a large number of urgent dental centres set up during COVID. Those practitioners have carried on working, but I do feel that we won't solve the problem in just working in silos. We need your support. I do
think you raise a really good point, though, Lucy. Sorry, I can call you Lucy now, Caroline, because yes, I do think you're absolutely right. We do get sidelined in a rural location. I do some national work, and I always, you know, it's like, don't forget Lincolnshire. People come out to Lincolnshire because they want the, you know, pleasant green land. But actually, don't forget, you know, and at the moment we are buying up land and we are putting houses on those pieces of land. Don't forget that we need to service that. You know, we need to service those. And they think about schools because, you know, they assume that you know, people will bring the wealth into the rurality. However, we also need to think about, well, yeah, what about, you know, the dentist side of it, the hospitals and all the things like that, but also, you know, the tourism. You know, we need to connect some of these up and saying, yeah, come to our wonderful green and pleasant land and actually come and stay here. Come and stay, come and live in the houses, bring your family, but, you know, come and work here as well. Don't just come and visit us, come and work here. And I think connecting all those things together and making us a little bit more of you know, a product. In some ways, people will shoot me now and say, we don't want people to come in our pleasant land, it'll spoil it. But we've got to get the balance right somewhere, haven't we? So Kenny, do you want to come in?
Yeah, thank you, Pauline. I mean, Carolyn and Adam will know that just how much, I wouldn't say a pain in the you-know-what I can be about promoting Lincolnshire.
Oh, you and me both.
You know, it's something that, you know, we're not forgotten. You know, we're not a forgotten county. NHS, as Carolyn has alluded to, NHS England are doing their level best to get access to Lincolnshire. But
there's still times when I sit in a meeting and they go, where's that?
Indeed, indeed. And, you know, we are trying as hard as we can, but we need, the workforce issue is the difficulty, really. Yeah. We also, if I can just go on a little bit, we also have been reliant for many years now on overseas dentists in Lincolnshire. And we have lost a lot of those dentists.
I'm wondering, as Healthwatch, what we can do, because one of the things you have mentioned, and I think it's similar in sort of GP surgeries, I'm going to say, when you now don't see a doctor, you don't get that frontline doctor, and what I'm hearing Adam saying is you don't get the frontline dentist like you used to. So I'm just wondering, with regard to what we can do as an interface to the public, as Healthwatch, how can we sort of start to bring in, what can we do and how can we work together with you in saying this now happens? Because sometimes it's what we know as what we've always experienced, and this is what we want, but this is not what we're going to get. So how do we make that change mechanism work for everyone? Because it seems as though you're making changes, but they need then to be understood, I'm going to say, and worked with across to our public, so that there is an acceptance going in there, rather than, well, I don't want that, I want to see my dentist, so I'm going to bang the table and stamp my feet. Does that make sense, Adam?
Yeah, no, that makes perfect sense. Obviously, Kenny's here today sort of in the capacity of the local dental committee sort of chair representing the profession, but Kenny also wears the hat of a local dental network chair, which is one of sort of the networks we have across the region. So working within sort of across the integrated care systems of Lincolnshire will actually sort of be crucial in designing some of the service provision for dentistry in that area, working with Lucy as well and the oral health teams to look at sort of how we address inequalities and what services are actually needed. And Kenny has quarterly meetings, and in that broader LDN, that's exactly where we want people like Healthwatch to be engaging. So we get that sort of from the people on the ground sort of feeding back into the whole system. So, and that's where it was coming from to begin with, that we need to be challenged. So if there's something we're saying, perhaps we should design something like this, and then sort of Healthwatch sits there and say, well, you know, sorry, we're hearing that this is really needed, then we can tailor things to best fit what is actually needed for the area, right down to a local level. And that's exactly, right down to that neighbourhood level, is exactly what's needed with the integrated care systems.
And I think we really do, Adam. I think we need to speak the language, and we need to access people where they live. You know, I mean, it's great being online for some people. Some people can't get out of their own homes, but, you know, I know, and Kenny will tell you, the last time we met, we were in person, weren't we, Kenny? And, you know, that's the first time and the only time we've done it in the past 2 years. But it, you know, the vibrancy and the interaction was really good. And, you know, let's hope we eventually get back to that. But, you know, again, it does come back to, there's cost elements to it, there's time elements to it, etc. But, you know, people are feeling forgotten because, and again, we look at our county and it's big, and it's, you know, it takes travel. So people automatically, you know, go, well, we'll just have to stay online. So people again come back to being forgotten because, you know, petrol prices have gone up, and you know, throw that into the mix, as well as, you know, the fact that they've got toothache and they can't travel from Mablethorpe to Louth because they can't get a bus. And you know, all these sorts of things are contributory to people's poor mental health. We haven't even talked about the mental health aspect of somebody having toothache. So there's so many ongoing things that are created, you know, from this, that we could sit here all day, all week, actually, all year, and talk about it. And I know we could, and I know that, you know, we value everything that's said, but somehow we need to start moving towards making those connections through to our public, and to make people feel like they are being listened to and they're being heard. And how we do that, I think this is a starting point. You know, this is the first time we've done this, and it, as I said at the beginning of my opening, it's been massive for Healthwatch. You know, it's been the biggest influx of people that, you know, that we've had, and you've followed that up with some of the conversations that we've had. So it's now we have to do something about it. And if we take it offline, Dean is your man to talk to. Liz and I are both on the Healthwatch steering group, and as I say, you know, we can take it back to the board. I know that we can do something, so let's not leave it. Let's not leave it to going away. I know, Lucy, you've done a video, haven't you, that we've put out. Kenny, did you do a video? I'm not sure whether you did or not. No, perhaps you didn't. You're shying away with it from it.
Hope not.
I know I tried to do one, and it's like, oh, they're very, very, very scary, aren't they? Did you find yours all right, Lucy?
Yeah, it was okay, actually. I have to say, I have watched it back, but Dean and I had a conversation about the pain of watching yourself back online.
I know, it's not good, is it? It's not good, but I know, thank you. But right, so we are coming up to 11 o'clock, and I know I would love people to stay on if they want to stay on, but I do know most of you do have other meetings to go to, so I do thank you for your time. I've been trying to keep up with some questions in the right, somebody's saying here, good to hear Caroline recognise the market failure and some of the most disadvantaged areas. So thank you for that, Caroline. And there's watch the interview from the dentist point of view, YouTube. So Una's put that in there as well. Yeah. So, and there's another one here. Chris says, many of my clients who have urgent needs of a dentist can't get to see a dentist, and many dentists turn new patients down. So again, Chris, do you want to answer that? Kenny, Adam? Should anybody really be turned down? Or Caroline?
Caroline?
You're on mute.
Mute.
Sorry, I don't use Zoom very often. Sorry, apologies. Patients are still being triaged. We are still asking dentists to triage patients. So if they're ringing up to say they want a routine dental checkup, I would expect the dental practices to say, no, not at this moment in time. We're prioritising clinical priority. the Chief Dental Officer of England has prioritised certain vulnerable groups, including children. So there is still a prioritisation going. My plea would be to anyone you're supporting, if you have clients, patients, relatives that have tried to get treatment, that have failed, then I would ask them to raise that with our customer contact centre.
Okay.
I'll share the details with Dean afterwards so he can share it out, because that enables us as a commissioning team to properly investigate it and actually take proper evidence on it. That does sometimes mean there is a delay in responses for patients, and I appreciate that can be very frustrating, especially when you're in dental pain. But that is the proper process for us to follow these up, and it's our only way of really understanding when practices are delivering what they should be doing, or actually maybe they aren't delivering what they should be doing. Okay. So that would be my plea.
Okay, thank you. Dean, have you got any quick poll indicators that you want to give us? Because I know you did some quick poll.
Yeah, Caroline's beaten me to one actually, because one of the quick polls was around people not understanding where to go for either to raise a concern, a complaint, or equally to raise a compliment with NHS dental services. But Caroline's just said that there is an email address which she'll share. But I suppose more broadly, where can people share their responses? So it was 68% of people didn't know where to raise those concerns or compliments, because it's about the good stuff as well as areas of improvement.
I've got one in the chat bar here saying, now there is a medical school in Lincoln. Is it time to open a dental school in Lincoln? Well, I say yes. What do you say? Investment, Kenny.
Yeah. So there has been dental schools opened in rural areas in Cumbria, a big part in Preston, should I say, and in Plymouth. And I've started working with the South and Southwest because of the similar rural type areas. So if I'm sort of thinking that question through, really, you're probably suggesting that if we open up a dental school, then people will stay around Lincolnshire and work in Lincolnshire. So for a dental school to provide the training that a dental school should do to, for a dentist to be properly trained and qualified, you need to have enough people. You need to have enough diversity of people in terms of age, whatever. But also you're looking at retention rates afterwards. And we know that the retention rates in Plymouth, for example, are not what you might expect afterwards. A dental school would be twice the cost of a medical school. We don't have enough academic staff at this moment in time either. So whilst a dental school is very much aspirational, it is the long term and the very long term. And I'm thinking that there may be other ways in between that we can get training, we can get a sort of, not the same sort of effect, but try to get people to come to Lincolnshire because they're being trained. So whilst I would always support a dental school, I think you've got to look at the other considerations as well there.
Somebody's put a point which I think is relevant, that it says in Cornwall there seems to be an issue with being able to retain dentists also, particularly among newly qualified dentists, and housing is a big issue as many NHS staff are unable to find affordable housing to either buy or rent. Now, I don't know whether that's similar in Lincolnshire. I think the Sue Hooper, that's in Cornwall, so I'm assuming that relates to Cornwall. I don't know whether that's similar in Lincolnshire. I know housing is probably lower.
Just if I can go on a little bit from that, we're talking, you know, largely here about dentists, shortage of dentists and whatever. You can't operate without your support staff. And we are seeing, you know, it's not just the shortage isn't confined to dentists, it's nurses and so on, really. It's the whole dental team, really. And I think COVID has had an influence there, because dentists were very much in the front line. We were right up close against patients' mouths and whatever. And I think people have taken a step back and thought,
Yes, I can say that that probably has some bearing on it, doesn't it, really? Yeah, very, very much so. Well, ladies and gentlemen, I think I'm going to, if nobody has any further comments or questions, does anybody want any final words of wisdom? No? I'm going to call this to a halt. I am going to say thank you so very much to the panel and to the public for coming in, and for all the comments in the sidebar that I think I've answered, or they've either been answered or they've been fed in. If there are any that we have missed, I guarantee you that Una will pick them up. I know Una's put some comments in there as she's gone along, but she will follow them up and feed back to whoever's put them in the comments bar. I really want to say thank you so much for, it's been a really interesting and insightful comments and discussion, and I hope you haven't been too challenged by it, and I do hope that we can work together as Healthwatch and with the public and with yourselves. And you've got the contact details of both Dean and Una, and please, anything that you feel is relevant, please feed into us. You know, we are more than happy to work together. We do have a couple of other events coming up. We have our I've talked about our Healthwatch steering group. We have that is going to be in public, so we will do this type of thing on the 13th of April, which Liz, I can see her, she's up there. She will be chairing that, so I'm going to sit back and let her come into the chair on that, and I deputise for her on that one. That's on the 13th at 10 AM, I believe, isn't it? No, does it start at 9, Liz, or 10? Oh, help me out here.
We'll confirm the timings nearer to...
Yeah, we will confirm and send it out. And is there anything else I've missed, Dean, that's coming up?
I don't think so. Una's put in the chat when our next YourVoice is planned for.
Yeah, I was going to say that our next YourVoice is on the 13th of July. I do not know whether it will be online or whether it will be in public, because nobody knows where we'll be then, do they? So Una will send out to everybody. She has your details, and she'll make sure that she'll send it out.